Welcome to this video. In this video, we will see how electronic medical records are maintained in Visual Hospital Manager. What you are seeing on the screen is Visual Hospital Manager interface. And let's go to the patient information. Now let me find a patient. His name is Sanjeev Patil. So I'm here on this patient's record. And now you can see that this patient was admitted. This is electronic medical records page where all the information about electronic medical records are entered for the patient. Now here you can see that we have a facility to enter complaints, history, examination findings, investigations if you have done any diagnosis, treatment, whatever is being offered to the patient, advice and follow-up, allergy related data, and then some analysis and specialty data. So specialty data, for example, could be if it's a gynecology package, it could be birth related documentation like growth charts or vaccination schedules and so on. On the right hand side, you can see that there is further additional clinical documentation possible. A doctor can prescribe investigations to the patient, prescribe medicines here, give a note to the referring doctor thanking them, or even give a referral note or hospitalization note where the patient is to be admitted to some hospital. Here you have a possibility to see the case paper, discharge card. You can also generate a blank discharge card if you want to manually prepare it. And then here you have an analysis data sheet. So for example, whatever analysis data we have specified for the patient, you can see what that data has been. So this is generally a layout of the electronic medical records page. Now let's try and see what is the case paper of this patient at this point of time. I would click on case paper. Now there are different options possible here. Of course, I can see regular case paper here and all the information that I had entered for this patient, like complaints, history, allergy, clinical findings, investigations. All this will basically start showing up on this page. I can also print it by clicking on this print button and it will be printed to the printer if I want. So you can see that all the information that is entered on this page will accumulate into the case paper. You can also see only the complaints of this patient. So for example, if I go to 21st, there have been 2 visits of this patient. On 21st, what was the scenario? So I can click on date-wise case paper. So here I have to say date-wise. Then I selected the date and I want to see date-wise case paper. So now here is the case paper which was there as on 21st of August. And then I can click this page, this date, and I can see what was entered on 25th of August, and only the operation notes were added on 25th. Nothing else was added. So it is very much possible that you can actually go back to a particular visit date of the patient in the past and see what was the case paper or what was the complaint history, examination findings at that point of time, and then look at what is today, and then you can have your comparative analysis also done. So this was the case paper. Now let's add a new patient and try to go through the EMR cycle completely. So I go to registration, add a new patient. Let's say this is Lunali Supe, just a random name, telephone number, birth date is 01/04/1987. Then female, height is let's say 156, weight is 56 kg, occupation is housewife, and now category is, I can associate one of the 7 categories, which mean basically 7 price lists. So here I'm going to just select general, but if the patient is from Bajaj Auto, for example, I have probably maintained a separate price list for Bajaj Auto using my master data configuration. And then I would select Bajaj Auto. So all the charges that are charged to this patient would be from Bajaj Auto's price list. That is how this category works. So I would select general. Who has referred the patient? So I can say Dr. Jogekar or Dr. Manali has referred the patient. Who is the consultant under whom the patient is admitted? Dr. Chaudhary. And then I would say here some Swargate, Pune, right? On 25th, for example, this patient has come, and I would say 2508 to 23 at 12:30 p.m. This patient has been admitted, and I would say save. So I have added this patient, and because it's admission, he has been allocated a IPD date. Now we go to EMR. Now this patient has gone to the doctor's cabin, let's assume. And then I would click on complaints, clicking entry form on 25th, let's say indoor. And now this is a symptom form that is available there. So I would just click something. I'm not a medical doctor, so I don't understand what I'm clicking. So please ignore the correctness of that. But I would just click a few symptoms. Labor pains, yes. Let's say image, whatever. Abortion. And then I will go to family history. Let's say there has been the patient has diabetes. Then medication, operation, appendectomy is done. Then in personal, let's say education, she is 12th class. She's a housewife, mixed diet, regular sexual conduct, and so on and so forth. And then in family, there has been a history of TB. And husband, let's say husband goes for a night shift. Okay, so I'm done with my family history symptoms, and then go to examination findings. Now for examination finding again, I would just click few symptoms. Tongue is moist, edema is present, for example. Okay, sorry, present, absent. Here, contractions are mild. ESP, NAD, it's closed. So I'm just clicking few for smelling, okay. Now, if I click on examination and say edit existing contents, this is what we just clicked. It's so easy basically to enter all this information. And then I can, in addition, say manually enter and dates. This could be like I had printed last night. Of course, this is complaints, but just for the sake of showing it. And then I could here say that, okay, I've entered this on this particular date. And then save this. So next time when I try to see it, what I entered is already here. Then I would also like to specify investigations done for this patient. So I can import predefined texts. So you can actually define a text which can be directly imported here. That will basically save time of typing for you. It will make it really easy. Or I would just say edit existing content. There is nothing. So I would just say CBC normal, urine routine normal, and so on and so forth. Whatever I want to write here. I say save. Now I would also like to say she is allergic to gluten products. I would save it. So now once I put something, this becomes pink. And then let's say I would select the diagnosis as, okay, again, this doesn't go with the symptoms, but just to keep it simpler, I would save it. Now I would like to prescribe medicine to this patient. So I'll go there, allergic rash, and I might have some prescriptions already in the library for this diagnosis of allergic rash. So I would say it's a mild rash, and I would just select this, and all those medicines will pop up. And then I'm able to put a remark as well. Consult your doctor if there are any reactions. And then I want to say for women, please inform your doctor, but of course she's there with you. And do not print diagnosis. If I click here on the prescription print, it will not be printed. And then I can also give a next appointment here if required, but the patient is indoors, so this is not required for now. And then I would preview this in English. This is how the prescription is already prepared. You can see how fast it is basically to prescribe. And it was basically because I had already developed a library for this. Now let's assume that I want to add another medicine. I'll just take something, Zaroff. And then I feel that this should also, okay, the method, I would say 2 times a day, dose is 1 in 5 days. And now I want to update this back into the library so that I can reuse this for another case in future. So here I would say rash moderate. So next time for allergic rash, when I try to retrieve from library, I would have allergic mild, severe, which were already there, and this moderate one, which we have just now put there. So you can see that there are 3 available variations for this particular diagnosis. Now this is how you build the library when you also are runtime prescribing medicines to the patient. Just imagine in 3 months, if you keep building this library, after 3 months you would have a saved predefined prescription for almost every case, or at least 90% cases. That will make your life really easy, and the prescription would be just matter of seconds. Now this can be printed in Marathi, Hindi and all these different languages, and you can print this on a pre-printed stationery or a blank stationery. You can choose to include hospital name as a header, or you could use a pre-printed stationery. Okay, so I have now prescribed medicine, so treatment has become pink. If I click on treatment and see, now these are the prescription that I have already prescribed to the patient. Then note to referring doctor. So I would say, dear Dr. Manali, she is the referring doctor if you remember. Many thanks for referring the patient. After careful clinical examination and tests, my impression is allergic rash. Yeah. And then I will keep in touch with you about further progress of the patient. That's it. If you want to include complaints history findings, you can click this, and whatever is already entered in our case paper, it will be included in this note. And then you can just print it and send it to the doctor. So this is how basically it will come. You can rearrange how it looks. That customization is also built into your package. So you can probably move this in between. You can space this up and down a bit, make it look better, change the fonts. All this is very much possible in the package itself. Similarly, you have hospitalization note where you can write to the CMO of a particular hospital. So referring patient for hospitalization, kindly admit and so forth. Yeah. Note to, okay, referral note is there. Again, dear, this could be some doctor's name where you are referring for your opinion and advice for further management, so and so forth. So this is how basically all the data is entered. Then there is also a possibility of associating analysis data with this patient, which you can then use for a year's patient data, for example, later after a year, to derive some kind of a research analysis. Or some doctors even have used this to find out if their investment in a particular equipment which should have saved patients has paid off or not. I mean, I can say that some patients who had cancer and who were treated with a particular equipment or the service, and they died or they survived. And this could give me a good analytical output to see if my investment in that equipment was worth it or not. So this is how this analysis data can be utilized. And in specialty data, you can have delivery record, vaccination schedule, and baby birthday reminders report. So this is basically if you want to send happy birthday wishes to the baby and his or her mother. So this is a electronic medical record. How is it maintained? And now if we look at case paper, I can simply go here and I would see the complaints that we have entered, history that we entered, allergy, gluten we mentioned, then clinical findings. If I go to the next page, then these are the medicines we prescribed. Allergic rash is the final diagnosis. Investigations that we prescribed. Now when in future this patient visits again, and I create a follow-up record, I get a choice to either associate all these complaints of this day to the future visit as well. So you have a combined case paper date wise, or you could just create a new record at that point of time without associating any of the previous complaints or history or examination findings or any electronic medical records of previous visit. So this is all I wanted to share with you in this particular session. Thank you very much.